If you or someone you know is considering IVF, then ICSI is the single best option for them. Hi, I am Dr. Ratnaboli Bhattacharya, Medical Director, ReproArt Fertility. In my last 15 years of experience, we have done ICSI for numerous couples and we have achieved success for most of them. So let us bust the fact. What is ICSI and what is the hue and cry about it? ICSI stands for intracytoplasmic sperm injection. It is an important step in the whole process of IVF and it is more and more important for those patients who are suffering from male factor infertility. It basically means that we fertilize a single egg with the best sperm that the embryologist can search and therefore increase the chances of fertilization or combination of the egg and the sperm. So let me just take you through a step-by-step ICSI guide. So what is our first step? Your first step is a consultation with a fertility specialist when you undergo a lot of testing to find out the reason behind infertility. So your infertility specialist, as a first step towards IVF ICSI, would run a number of tests for both you and your husband. Along with that, she would be giving you certain pre-treatment medications so that you're in the best of your health. Both you and your husband are in the best of your health to plan your fertility journey. The second step is ovarian stimulation, which typically starts from day 1, 2 or 3 of your periods and involves a number of hormonal injections for around 10 to 12 days to form better eggs and a more number of eggs. Along with this, you would undergo regular monitoring through ultrasounds and through blood tests. When the eggs are mature enough and they are ready, you get one triggered injection which causes the final stage of maturation of eggs. The third step is egg retrieval or egg collection. So this is done in an operation theatre where you're put off to sleep, you're given general anesthesia and under transvaginal ultrasound guidance, we take out the eggs, we suck out the eggs from your body through a single needle prick. Once your eggs are retrieved, your husband's semen is collected, it is prepared and the embryology takes all the preparations for the next step, which is the actual ICSI process. So the fourth step is ICSI process. So here what is done? The eggs are fixed and one single best sperm is selected from your prepared semen sample and inserted inside the eggs, just to improve the chances of fertilization or combination of the egg and the sperm. Now we come to step 5 or embryo culture. So now that fertilization has taken place, the embryos are grown in culture in our lab for the next 3 to 5 days. Step 6, embryo transfer. So once these embryos grow to day 3 or day 5, these embryos are then put back inside your uterus if your uterine lining is as per expectations. And the last step or step 7 is your pregnancy test. So after embryo transfer happens, you wait for the next 2 weeks and then take the pregnancy test with a blood test or a urine test just to see whether the embryo is implanted and whether you're pregnant or not. So who are ideal candidates for ICSI? Men who have low sperm count, where sperm motility is not good or the sperms are looking abnormal. So these patients are ideal candidates for ICSI. Besides that, we often suggest ICSI in patients who have had previous IVF failures or previous IVFs where the egg had not been fertilized by sperm in conventional methods, or somewhere where we are using frozen sperm, or cases where we take out sperms directly from the men's testes. Moreover, fertilization rates, or more simply, embryo formation rates are higher with ICSI than with conventional IVF. So why ICSI matters? Number 1, it bypasses the barriers of the sperm by fertilizing the egg directly with a single selected sperm. Number 2, it increases the success rate by improving the fertilization or embryo formation rates. But lastly, we have to remember that IVF success definitely depends on the age, the egg quality and the sperm quality along with the quality of the uterus. So before we compare conventional IVF or ICSI, these are the other success factors that we should always keep in mind. Hope this clarifies all the questions that you've had about ICSI. Do get back to us if you have any more questions. Thank you.